You are live now.
Thank you. Is this recorded for the people to see outside or on YouTube or something?
Ms. Davis, this is being live streamed on YouTube, as always, and it is written on the agenda.
Okay. You went back to doing that again?
All right, it's 03 on Thursday, October 8th. This is the regular October monthly board meeting of the Jefferson County Health Department Board of Trustees. So as chairperson of the board, I call the meeting to order. As was just mentioned, the meeting's being live streamed on YouTube. And so can I have a roll call, please?
Mr. Deal,
Here.
Dr. Henry,
Here.
Mr. Prater,
Here.
Mr. Pig,
Here.
Ms. Davis.
Here.
Okay, all board members are here, so we have a quorum. We usually read the health department mission and vision. Dr. Henry, could you do that, please?
The Jefferson County Health Department will champion positive health outcomes and behaviors through innovative programs and community engagement. And the vision is advancing the health and safety of Jefferson County.
Okay, thank you. So all board members have received a proposed agenda. Could I have a motion to approve it, please?
I'd like to make a motion to amend the agenda, please.
Okay,
I believe we need to take the September 23rd, 2021 meeting minutes off, correct, so? I believe we need to remove those because those are not ready.
those are not ready to be approved, so we'll table that till next month.
Yes, thank you. Table for next one.
Okay, so we have a motion to amend the agenda by removing that line item.
I'll second.
And second, any discussion? Okay, hearing none. That amendment's approved, so we have a motion to approve the amended agenda.
So moved.
Aren't you going to ask if there's a discussion on why it was amended? To move it? So why did we move it? So that the people that are watching understand, what's going on? Mr. Pig, if you would, please.
But they weren't prepared. They are not ready for us to approve.
So they're not in a written form where we can read them as a board?
Correct.
Okay. Thank you.
Okay, so do we need to approve the amended agenda?
Yes,
We have a first and a second.
yes.
We have a first and a
We
second.
have a vote on that, sir.
Any other discussion on that? So hearing that, we have an approved agenda.
No, we need to take a vote on the
Oh,
amendment
I'm
first.
sorry. Everyone in favor of the amended agenda, please say aye.
Aye.
Anyone opposed?
Now we need to make a motion to approve the amended agenda. We never voted on the first, so we gotta approve the amended agenda now. We voted on the amendment, now we gotta approve the agenda
Sorry.
as amended.
I thought we just did.
No, that's right.
All right.
I make a motion, we approve the amended agenda.
I'll second.
Good. Any discussion on approving the amended agenda?
Is there a reason why those minutes are not ready, that where they usually are ready by now? What held them up?
Can you answer that, please?
Ms. Davis, there were several sets of meeting minutes that needed to be compiled for this meeting, as well as Debbie has been overseeing several requests for additional documentation through her office over the past month and wasn't able to get them completed in time. She will have them available for the next month's review.
Okay, and what were the additional requests that were being asked for? Was it other than something I asked for? Was it other people too as well?
I call the motion to vote.
Call the question, all in favor of approving the amended agenda, please say aye.
Aye.
Any opposed? Okay, so amended agenda is accepted. Next item is approval of the September 29th, 2021 tax rate meeting minutes. All board members were present except James. So I have a motion and a second to approve those.
Make the motion.
I'll second.
Any discussion on those? Okay, so all in attendance who approve those minutes, please say aye.
Aye.
Opposed? Okay, those are approved.
I make a motion, we approve the October 18, 2021 special meeting minutes.
Have a motion to approve those. In a second?
Second.
Second, everyone attended that meeting. Any discussion on approving those minutes? All in favor of approving the special meeting minutes, please say aye.
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 Anyone opposed? Okay, so those are approved. Next item is approval of the September 2021 expenditures. Now I have is $122,000. I'm sorry, $122,064.37.
Motion to approve.
Second.
So we have a motion and second to approve those expenditures. Any discussion? Okay, all in favor of approving those, please say aye.
Aye.
Any opposed? Okay, those are approved. Next item is approval of the September 2021 electronic payments. Actual amount that I have is $491,875.99. Motion to approve those?
Motion to approve.
Second, please.
Second.
Okay, so motion and second to approve those electronic payments. Any discussion?
That didn't come in my packet. I didn't get a copy of it. Can we table that till the next meeting and approve it then, so that I get a good look at it?
Did everybody else
It was in
receive
the
it?
packet.
I got it.
It was in all the
It
packets.
was
They
in
were
the
received
email.
at the same time.
It was in the email.
Well, I said I didn't receive it, so I would like to look at it.
You get a packet, Ms. Davis?
I've got some of the stuff, but I did not get that one. I got the $122,000, the $8,800 expenditures, but I did not get that one, the $400,000.
Miss-
Electronic.
Mr. Chair, just for clarification, when our board secretary Jennifer sends out the board packets, she sends them to all board members at the same time. So
I
they all,
also did not get the agenda. I had asked for it again, so I don't know what's happening. I'd sure like to talk to Jennifer about it prior to the meetings, make sure I have everything complete before, at least an hour before. Maybe her and I could have a chat.
Did you,
Sure, I have it
did
all.
you or did you not get a board packet, Ms. Davis?
I did not get a full board packet. I have part of it. And I scrolled through my email. I looked
That's
for it.
impossible.
I found a couple of things. I printed them out, but that was not in there. It's all.
They all came together.
I
They all
have-
came in the same email.
And yet, I'm asking to be able to look at it before we approve it. So can we please put it on the next agenda?
Davis, did you get an email from Jennifer Pinkley dated Wednesday, October 27, timestamp 12:30 p.m.?
Let me look into my emails again and let's see if I did. Because I was looking over it for the last hour and couldn't find it.
Maybe we should prepare a little ahead of time.
I've been looking well in advance. Nope, it's not here.
Ms. Davis,
By Susie D, right?
files of all of the emails, but one, the packets are always provided to all board members in the same email, so it would be impossible for you not to have received documents that the entire rest of the board has received, as well as all board members who are in attendance at the facility for the meeting also receive a hard copy of all documents. So that is a additional backup for those members who choose to attend in person.
I've got my email.
Okay, so what would be a good
Quick
idea then
question.
is for Jennifer to go ahead and forward that email to me again so that I can see my name on it, that it was sent to me, because it's not in my email box. That's all I ask. Okay? Not here. I'm looking. It's not here.
So as far, Ms. Pinkley will forward that information to you again, but the attorney has just stated that we do not have to wait on a call to vote.
So if we have a majority approve those, then they're approved. So and motion and second, we've had discussion. So all in favor of approving those electronic payments, please say aye.
Aye.
Anybody opposed other than Ms. Davis?
I'm opposed till I can look at it.
All right, that passes 4-1. And last item is pre-approval of the November 2021 electronic payments. Estimated amount on those that I have is $581,997.25.
I also do not have that one.
I make the motion.
Second.
A motion and a second. Noted, Ms. Davis said she didn't get it. So, any other discussion? All in favor of approving those or pre-approving those payments, please say aye.
Aye.
Anyone opposed?
I'm opposed till I can look at it.
Okay, so that passes 4-1. All right, next is our director's report. Director Bowman.
I would like to first call our mobile wellness staff into the room for a presentation regarding our mobile wellness van services. Hi, ladies.
Hi.
This is where you would like for us to see.
To the left there.
I'm trying to see, yeah, if you can come over just a little bit so that the owls will be able to pick up your voices and be able to see. I know it's a little intimidating, but it's not. When you talk, you'll see yourself up there, but just try to speak loud so that you can get. Like to introduce yourself?
I'm Debbie Moore. I'm the program coordinator for the mobile wellness van. This is Mary Tongay. She's a nurse practitioner. We work together along with our 2 alternating medical assistants on the wellness van. We are a medical clinic that goes out into the community approximately 4 days per week to offer primary care to individuals with and without insurance. Some of the sites that we visit monthly are Entry in Cedar Hill, DeSoto Farmers Market, Oak Ridge Church in Arnold, and a few of the residential care facilities in the county. We also offer immunizations and sports physicals to several of the school districts in the area. We see patients for a variety of medical services. We are able to provide primary care services utilizing a collaborative practice agreement with Dr. Pascal Goudreau. Dr. Goudreau serves as the supervising physician for our medical services. We have several regular patients that are being treated for chronic illnesses such as diabetes, hypertension, thyroid disease, and hyperlipidemia. That's a mouthful. High cholesterol. We also see patients for common illnesses such as strep throat, UTIs, ear infections, and rashes. We serve as the primary care for one assisted living facility in the area, and we provide resources to patients with issues that are out of our scope of care. Thanks to grant funding from the Missouri Foundation for Health and collaborations through organizations such as the Jefferson County Rotary Club, we are able to help underserved communities in Jefferson County by providing free or reduced cost care. Most individuals are extremely grateful for our services. Many of our patients had postponed medical attention for years due to lack of insurance, transportation, and fear of a catastrophic diagnosis. From the moment a patient calls till the time that they arrive for their appointment, we do our best to make them feel welcome, comfortable, confident about the care that they will be receiving. The mobile health center is a quiet, private space which ensures patient confidentiality. This also helps to ease any anxiety they may have about their visit. Mary and I both take a lot of pride in the work that we do. It is very rewarding to be able to help those in need. We hope to continue this program for a very long time, and we appreciate all of the support that we receive from Jchd.
Thank you.
Thank you. Are there any questions or anything that we can answer?
For the ladies?
And say they are always looking for new opportunities. And is it one of the school districts are actually going in and doing physicals and working with the staff members on staff wellness. And so they've really opened up a lot of new opportunities over the last couple of months in terms of finding new ways. The idea was to provide new access points and get care out to where people are and meet them where their needs are. So these ladies have done a fantastic job of making sure that's done.
Thank you very much.
Thank you.
Thank you, ladies, very much.
Thank you.
Thank you.
Okay, just second, I would like to review our week 42 COVID updates, just to give a little clarification and guidance. So I know that you guys received this along with several of our community partners. And when these come out, one of the things we've been trying to do is just simplify the format to make it easy for individuals within the community to just get an overview of where our cases stand at, where we stand with vaccinations and those kinds of things. Very excited to state that we have been seeing decreases for the last couple of weeks. So we've actually seen our weekly case count decrease 18.4% from last week to this week, or this and our positivity rate has also decreased down to 7.73%. So we are seeing some good trends in our numbers. The case status that you'll see, so for those of you who take a look at our weekly reports, we have speedometers basically on there that kind of show the level of transmission within a community. The 7-day case count, which we look at the 2 CDC indicators. So one is 7-day case count per 100,000 population. We're sitting around 151 cases for that indicator. And then our test positivity is sitting at 7.76. When we look at those, they really reflect the threshold or the zone that we're in. So our 7-day cases are sitting in our red zone, which is high transmission within a community. Our test positivity is sitting in the yellow zone, which is showing moderate transmission. What that comes down to, though, is CDC and looking at our color status for our county reflects those 2 indicators together. So when we look at those 2 indicators together, CDC requires that we utilize the highest level color as our color status. So for this past week, red is still our color status. We remain in red. As far as the transmission, though, we are again starting to see those go in a positive direction. So as we continue to look at our cases and review those, we'll continue to keep you updated. Just letting you know again, in week 42, there were 82 new youth cases, which again is good news. It's not good news, but it's good news because it's the first time this number has been in double digits since July. So again, seeing those numbers start to come down. Our total cases, our total vaccinated individuals are 43%. And of the 411 new cases that we had this past week, 341 new cases, 78.9% were vaccinated or unvaccinated. I am so sorry. of our cases, 78.9% were unvaccinated. So we are definitely seeing good results with the vaccines in the coming, I think by next month, when it's a little more established with the pediatric vaccines and the boosters, we'll probably have Melissa come in and talk to you and just maybe answer some questions you may have about how those are going. And then as well, just continuing to let you know that as we are seeing reductions in our cases and are being able to look at how we go about doing mitigation in our community and re-engaging our staff, we are starting to pull back in, and again, we're re-upping and lifting up our core services that we do for public health and are re-engaging with the community in those ways. So very exciting news as we continue to see those numbers are coming down, but just continuing to reiterate that we remain in red at this point in time because we always have to go with the highest level of color indicator per CDC guidance. If anybody has any questions, otherwise that's the end of my report.
I have a question, Kelly. So the positive cases that we're seeing, what establishes how the people are considered positive? You know, they've established the studies have shown that the PCR tests are very faulty. So, and then also that the children that are, you know, testing positive that are in this double digits now, you know, are you seeing any of those children sick and staying home from school and or in the hospital?
So again, Ms. Davis, as has been repeated multiple times, the tests are not faulty. That is a misstatement that needs to be corrected for the record for our notes, because we are not seeing faulty tests with the PCR tests and with our traditional testing. As far as the youth cases, we are continuing to see youth cases. The pediatric hospitals have seen children in both the inpatients as well as in the ICUs utilizing vents.
In our hospitals or in St. Louis hospitals? In our
I
hospitals?
would ask that you allow me to finish my response to your question. So yes, we have seen pediatric patients who have had to utilize vents and other measures that are more extensive for care of life. And then finally, as far as the, lost it because you interrupted. Looking at the PCR tests, our positivity rate, one of the things that has been brought up by the state epidemiologist in our most recent conversations is the having to reevaluate how we look at our testing numbers in terms of percentage. Because of the influence of the at-home tests, we're not seeing as many tests going into CLIA certified labs. That is starting to have an influence on those numbers. And so we have to be very careful as we evaluate those percentages to understand that the numbers that are going to be coming across are going to be those that are coming through CLIA certified labs and through the traditional sources. For those who are doing home tests, that does influence then the number of individuals who are going to those more traditional sources.
So what about those antigen tests? Are they also still included in there, or have they been removed? You know, the people that are testing positive for having good immunity.
So individuals, sorry.
Go ahead.
So as far as individuals, the PCR tests and I believe antigen tests are, I want to double check with Melissa on that to ensure that I am saying the correct test. So basically those that are looking for active infection, the PCR tests and for an acute reaction are the ones that are being considered for positive cases. Those that show a previous infection, we can't know whether that infection is current or previous. So looking at something that is looking for previous immunity is not something that would be utilized to be able to show current infection.
So what you're saying, let me get this right, is that the test that you're doing, you're admitting that it can't really tell if it's a current infection or something that someone had previously, correct?
No, Ms. That's not what I'm saying at all. What I am saying is that the tests that are utilized at the health department and those tests that are utilized at the labs are specifically designed to look for acute. Right now, the individual has an infection, and those are the cases that are being counted as new cases. So no cases, there is no faulty test. And if you would like to have a more specific conversation with Melissa, who is in charge of our clinical services and oversees all of our testing programs, I think that she would do a fantastic job of helping to educate you. And
I would love it. I would love to have her personal extension or her, cell phone number. I'd love to be in touch with her.
All right,
Right.
the questions asked and answered. Thanks, Ms. Davis. Kelly, I have a question.
Yes, sir.
And I'm sorry, it's probably something I should know, but are the program reports that we get available online to the public?
We can make those available online to the public. So this is the first month we've started pulling the program reports back in.
Right.
As the programs have picked back up from doing COVID duties, we've asked them to start relaying those reports back to the board.
Okay.
So we can add them. Yeah.
Yeah, that's great. And the reason I bring that up, just real quickly, there are certainly some things in there that I think would be beneficial for the public to know. For example, under the environmental report, we had 10 animal bites last month, and one was a positive rabies report that was on a bat. And so I don't know the circumstances of that, but one thing we always have tried to make people aware of is if they see a bat on the ground, bats cannot take off from the ground. They have to be in a tree or some elevated place in order to fly. And so if you see one on the ground, do not touch it. And I'm not sure what happened in that situation, but those are the kinds of things that I think it's good for folks to be reminded of. And one other quick thing too, I saw that we distributed 10 doses of Narcan in our other report. And
Health Network.
yeah, just curious, is that about an average that we've been seeing, or?
So as far as the part of that is doing presentations to partners. We are working with a couple of state programs to be able to do education on the distribution and administration of Narcan to the community members. And again, trying to promote having individuals who are trained and have access to it to be available in case of an overdose. So it's about, from my understanding, we're getting back into doing those presentations. So I apologize. I'm not sure if that's a normal monthly average, but I can check with Heather and find out.
Okay, just curious. It's good to see those reports again. And I think it'd be helpful for folks to see some of that information too.
Sure.
So thank you for that.
So Kelly, I have one last question here. I know a lot of the constituents that I've been talking to are asking, with these numbers coming down, the percentages coming down, hospitals are able to handle the flow. How quickly are we going to be able to see those masks come off of the kids and at our health departments so they can walk in and not feel isolated if they're not a mask wearer, and they can just come in and feel at home at their health department without feeling like there's, draconic measures in place? When do you see that happening?
So Ms. Davis,
Going in the direction it's going.
as a public health board member, I would hope that you would support CDC guidance and as well be informed as to the levels that we would be looking at. So as far as looking at guidance and recommendations, those levels would likely be around the moderate transmission range. As far as looking at our transmission, we are currently still in high transmission status with red, and as it being a healthcare facility, we have to ensure that both our clients and our staff are safe to provide services within an environment where you have the potential for transmission of a communicable disease. As far as Ms. Davis, as far as the recommendations to the school. Schools set their own policies through their own boards. And so the individual boards of schools are the ones who would make the decisions regarding masking requirements, but we do make the recommendation that schools utilize multiple mitigation measures, including masking, social distancing, having good hand washing and hygiene practices, as well as looking at the individual contact tracing and things like that in order to be able to manage the risk for COVID. So again, there are several CDC recommended best practices that have been shown to significantly decrease the spread of COVID, and we are always working to promote those best practices in our community.
So I'd like something put on the record regarding the track record of COVID over the past 16 to 19 months, however long it's been. You know, we're still seeing a 1% or less death rate from it, and the hospitalizations haven't been as high as what we had thought it might be, and the survival rate of COVID is actually 99.97%, and that the natural immune people that are not taking the vaccine are doing quite well. And I know you're saying that you're getting some cases where people are not vaccinated, but they're coming through it, they're surviving it, and it's not as bad as what we thought it was going to be. So I'd like to see us back off of these measures. I'd like to see us come down off of it, remove these masks, quit pushing the vaccine so hard, and get on with our life. It's hard for the kids, it's hard for the community, it's causing more problems than the good that you think that it might be doing.
1,000 US citizens who are now dead, so, okay.
Mostly over 80 years old and with several comorbidities, otherwise, no.
Motion that we approve the Jchd 2022 holiday schedule.
Okay, you all got a copy of that. Are there any differences this year from last year, Kelly?
No,
It's the same.
sorry.
You're good. Yeah.
I didn't see anything about New Year's Eve, Christmas Eve. Are we waiting?
Christmas
waiting for-
falls on a Sunday this year,
Right,
so.
okay, so
And New
or
Year's
next year,
Day
sorry.
is there in January.
in the past, we've kind of waited for the state to declare any of those, so we'll do the same, which may not happen because of the day it falls. Okay.
I'll second.
Okay, so we have a motion and second to approve the holiday schedule for next year. Any other discussion?
Exactly what is the holiday schedule?
Ms. Davis, it was included in the packet that you received from Jennifer.
What you don't understand, Kelly, is the people that are watching this, they don't have that packet. So it would be kind of us to let them know the dates that we've chosen, please.
Holiday schedule, once approved by the board, is posted on our online forums as well as on our Google Calendar that the community has access to.
Those are all state or federal holidays. We don't choose those.
I think maybe I'm misunderstood then. I'm just looking for the dates of our next meetings.
This is a
We're not
holiday.
discussing that. You're talking about the holidays that the health department's gonna be closed now. Is that what you're talking about?
Yes.
Okay. Two different things. I'm talking about future meetings.
Okay, all in favor of approving next year's holiday schedule? We have a first, motion second to approve those. All in favor, please say aye.
Aye.
Anyone
Aye.
opposed? Okay, so that's approved. And the next item is approval of the preliminary 2022 budget.
I make a motion, we approve the preliminary budget for 2022.
Second. Okay, we've got a motion and a second to approve the budget. Everyone who got a packet received, I think, 3 different sets of information on the budget. So any questions, any discussion on that? Kelly, what budget?
Dennis, I apologize, but I do need to ask, how about, since I'm doing the Zoom and there seems to be issues with getting information to me for whatever reason, could we please get a full packet for me? I may even like, intercept it like somewhere, so, send it to me a couple, 2-3 days in advance. You guys have it done that quickly, right? Before the meeting, at least a couple.
Again, provided this information to you multiple days before board, as we are able to.
Instead of by email, I would like it in a hard packet that could be, send it out to me, have a courier.
The offer has been made and you have refused to, you said that you would pick up the packet and have refused to come to the office to pick it up because of the mask policy. So we have offered to provide all of the packets to you, as we have done for every board meeting, to every board member.
I will take you up on it. I will take a packet, full packet in advance. And just give me a phone call when it's ready. I'll make arrangements to pick it up. I don't want to chance going through emails and not having it. Okay.
Davis, again, I encourage you to recheck your email because it is extremely difficult.
I don't want to go through that again. I just would like to have a hard packet like everybody else that's sitting at the table. They have it in front of them. Okay. So I'd like to have that when it's ready. I'll come get it.
Okay, so
Okay.
any questions or discussion?
You can ask Mr. Deal.
The budget? I just had a couple quick things. It was nice to see a comparison between this year and next year. And there are a couple line items that are pretty different from one year to the next. So I was just hoping for some information on some of those. State contract fees have gone down. $44,000.
So some of the grants and contracts we have, their federal and state percentages vary from year to year. It's just a difference. It's not a funding difference as much as a percentage of federal versus state.
Okay, have we lost any grants or contracts?
We haven't lost any.
No.
No, we had a little reduction in a couple of them, but
Okay. All right. Let's see. Program service fees, we're gonna see 115,000 and some dollars less on those. Why is there such a difference on those?
on those, figure those out, it was based on what we can anticipate to come in. So I think maybe we budgeted a little high last year, so we just kind of did it together when we're evened out. Expectations.
Just an adjustment, basically. Okay, let's see. So we have program and medical supplies are lower by $620,000.
So last year we had to make a, we entered into a contract with, I forget what the company is called. They're the ones that did the testing supplies for COVID. And we did not have to go through that this year, so.
Okay. So trainings, conferences, and meetings are down almost 26,000.
This year, we reduced a lot of our trainings and conferences to only what our contracts and grants were covering. We have a few that are not covered by grants, but most of them are.
Plus, I guess a lot of them are virtual now instead of in person.
Yes.
Okay. That's helpful to me. Thank you. I appreciate that. So we have comparison and then a breakdown of all the line items. Is there any other information anybody would like to see that they don't have or they have questions about on the budget? Any concern? Kelly, can you explain? This is preliminary because we don't have clear amounts yet for the building process.
So there's two reasons. So actually, we've also received some guidance since I made that explanation earlier. So it's preliminary until the board approves it. Once the board approves it, then it's our approved budget for the year. We need to have a copy of the budget to the county by October 31st. So this budget would need to be approved. But in the meantime, we have talked with our auditor about we were trying to look at how we would budget for our upcoming expenses that will be happening with looking at the property and trying to work with architects. But we are not far enough along into the process at this point in time to be able to have numbers to put into this budget. What he has stated is that we can actually have a non-operating budget. Is that what it
It
was
would
called?
be the non-operating section of our budget, so it would just kind of add on to this one, but it doesn't change our operating budget.
So what it would do is keep a clean copy basically of what is being spent and for just specifically that purpose. And so that was a recommendation, is that we could do that, and that way we could go ahead and approve this budget. And then as we get additional information, we could set that budget and bring it back to the board for approval.
Any other questions? Concerns? Okay, so I don't know if you feel comfortable approving this, but it does need to be done by the end of the month. I have a motion to approve the preliminary budget.
Yeah, you gotta put your motion.
Yeah, okay. I'm sorry. Too much discussion. Right, hearing no other discussion, all in favor of approving the preliminary budget, please say aye. Aye. Anyone opposed?
I'm opposed. I don't have that in my packet.
Okay, now that passes 4-1. Okay, we do have some items for closed session, correct? Okay, so
Again, Dennis, to be clear, could Jennifer please print all that out for me and have it sent or mailed to me in the US mail? I need to have it.
Just so that I just would like to make clear for the record that you have been sent all of the information that has been sent to the entire board.
That's
I do not-
debatable because it's not in my mailbox. So please send it to me in the US mail. I need to have it, okay?
that we have a staff member who is not completing the responsibilities of her position. I will ask, or I will respond to Dennis's request to provide any additional information that he asks of our staff. But I do ask that you stop making insinuations that you have not received material that has been sent to the entire board. It is-
Dennis, I'll address this to you, sir, as our chairman. Would you ask that the health department please provide me copies of all these papers and reports that I didn't get today? Just a full packet of everything. That's all I ask. Email to me. And then in the future, Mr. Chairman, I would ask again, to be clear, to have a full packet at least 2 days in advance of this meeting. And when it's complete, as soon as it's complete, to get a hold of me and talk to me and ask me, do I want to pick it up or do I want it couriered or whatever? But I want that. I don't want to go through this again where there's partial information provided to me. That is definitely a sunshine violation, and I'm not going to put up with that.
I think that's a very.
I was gonna say, Miss, Christie, as our counsel, can you please say that loud for the record?
Ms. Davis, it's not a sunshine violation. The packet is made available to all members as soon as it is complete by email. It is also made available in person at the meeting. You are more than welcome to attend the meetings in person. If that's a problem, if you're not receiving things by email, you are welcome to come in person, or you're welcome to come and pick them up at the health department whenever the packets are made ready. That's not a sunshine violation, ma'am.
They will not be ready in time.
Not to argue, but please just provide the packet to me in a hard copy is all I'm asking.
That's fine.
Thank you.
But
Thank you.
It's ready when all the information's available.
As soon as it's all done, just let me know so I can make
That's
sure
fine.
that I get it in my hand. Thank you. That's all I'm asking.
Tell me what email address we're supposed to be using.
No,
for you?
I don't want to trust the email.
Well,
Having
it's
too many issues with it. I'm just gonna do hard copy from now on.
You're
that way
saying
I don't have to deal
that
with that.
email, we should not email you for any reason? Is that right?
Call me.
You never answer your phone, ma'am.
Yeah, I will answer, or text me. How about that? Text me, tell me to call you if it's urgent.
We need a record for the custodian of records for any information that we share. I can't do that.
So Ms. Davis, as you've been informed several times, the custodian, all communications between board members are required to have a copy sent to the custodian of records email address for the health department. As you have been instructed as well, you are to have a email address for board communications. You have now given us 3 email addresses. You keep changing the
Just
one.
send it to Susie D 6722@att.net. I've not given you 3. That's the one I want it sent to, period, end of sentence.
Need to stop sending emails from the other 2 email
That's
addresses.
just where, that's the email
Utilizing
when I'm
your-
on my phone and I'm emailing, it comes from there. But send it to Susie D. That's the one I get. That's when I'm in front of my computer on my Mac. That's the email address that I use. Thank you.
Okay, and the email address that was used to send this board packet was Susie D.
Well, it's not there. So I'm not gonna take that chance. Send it to me in a hard copy. That's all I'm asking.
Go to closed session, please.
Motion to go to closed session.
All right. For the purposes of
610-0021, number 1. Number 2.
And 14.
And so we have a motion to go into closed session. We have a second.
Second,
All right, thank you. Any discussion?
Yes, I have some discussion.
Okay.
Are we gonna be ensured that this meeting is truly closed and that the information discussed inside the meeting stays closed? Maybe it's an arbitrary question, but
Is it okay to give the budget number? Just not give it to them, let them see what the budget number is.
before we approve,
I
I retract the question.
They'll go back in there.
Do the roll call, please.
Mr. Deal,
Yes.
Dr. Henry,
Yes.
Mr. Prater,
Yes.
Mr. Pig,
Yes.
Ms. Davis.
yes.